1. Measles surge. 33-year high and anti-vaccine concerns what you need to know. 2. U.S. faces worst measles outbreak in over 30 years. Causes, impact, and vaccine urgency. 3. U.S. measles outbreaks near record high. What you need to know. 4. Measles outbreak in Kentucky. 11 cases confirmed in 2025. 5. Measles outbreak 2025. Record high cases in the U.S. 1. Measles surge. 33-year high and anti-vaccine concerns what you need to know. The United States is experiencing its worst measles crisis in 33 years, a preventable tragedy fueled by vaccine hesitancy that's putting lives at risk. And here's the heartbreaking reality. This outbreak isn't accidental. Let's break down what's happening, because understanding this could save lives. Right now, Gaines County, Texas, is the epicenter of the largest outbreak, spanning 4 states and accounting for over 950 of the 1,281 national cases. But this isn't isolated. A shocking 27 separate outbreaks have ignited across the country in just 6 months. National data from Yale School of Public Health, as of July 6, shows cases across 39 states, with 90% linked to identified outbreaks. The CDC updates weekly, and their latest report confirms at least 155 hospitalizations and 3 tragic deaths, 2 unvaccinated children in Texas, and 1 unvaccinated adult in New Mexico. Every single death was preventable. Here's where it gets controversial. 92% of all cases involve unvaccinated individuals, or those with unknown vaccination status. The data is crystal clear, but why are vaccination rates falling? Most victims are children and teens, with 28% under age 5 and 37% between 5 to 19 years old. And this is the part that should outrage everyone. We have a safe, effective vaccine that could end this overnight. Yet influential voices, like RFK Jr., continue pushing anti-vaccine narratives while children die. So I'll ask plainly, when evidence proves vaccines save lives, how do we justify allowing misinformation to spread? Should parents have unrestricted freedom to refuse vaccines when it risks community-wide outbreaks? Share your perspective. Do you support stronger public health mandates, or see this as government overreach? 2. U.S. faces worst measles outbreak in over 30 years. Causes, impact, and vaccine urgency. The United States has recorded its most severe measles outbreak in over 3 decades, sparking urgent calls for action as officials warn of a public health crisis fueled by vaccine hesitancy. This epidemic, which began in late January in a rural Texas community, has already claimed 3 lives, 2 young children and 1 unvaccinated individual, while nearly 40 states have reported over 1,277 cases this year, with Texas accounting for more than 60% of the outbreak. The Johns Hopkins University report, published on July 7, highlights a stark contrast between the country's past success in eradicating measles and its current struggle against a resurgence driven by declining vaccination rates and growing distrust in health authorities. The disease, once deemed eliminated from the U.S. due to widespread immunization programs, is now resurging in communities where vaccine skepticism is rampant. Experts caution that underreporting of cases may be masking a deeper crisis, as the toll on public health remains underestimated. The last major measles outbreak in the U.S. occurred in 2019, when Orthodox Jewish communities in New York and New Jersey faced 1,274 cases with no fatalities. However, this year's outbreak has outpaced historical patterns, with the U.S. tally surpassing the levels seen in 1992. The situation has intensified amid accusations that President Donald Trump's health secretary, who has long criticized vaccines, has exacerbated the crisis by fueling fear about the measles, mumps, and rubella (MMR) vaccine. The secretary's false claims that the shot contains fetal tissue have fueled public anxiety, despite its proven efficacy. This narrative has coincided with a surge in outbreaks across the U.S., Canada, and Mexico, with over 3,500 cases reported in Canada and nearly 2,600 in Mexico this year. The outbreak's severity underscores a broader tension between scientific evidence and public perception. While vaccines have saved millions of lives, misinformation and political rhetoric have created a climate of mistrust. As the U.S. grapples with this crisis, the question looms: can public health efforts withstand the erosion of confidence in medical institutions? Or will this outbreak become a symbol of the growing divide between science and society? The answer, however, lies in the hands of policymakers, healthcare providers, and the public, who must work together to restore faith in vaccination as a cornerstone of collective well-being. 3. U.S. measles outbreaks near record high. What you need to know. A concerning surge in measles cases across the United States, Canada, and Mexico is prompting urgent public health responses, and the numbers are climbing dramatically. But here's where it gets controversial. Despite decades of vaccination efforts, we're seeing a resurgence of this highly preventable disease, raising serious questions about vaccine hesitancy and public health infrastructure. And this is the part most people miss. The situation isn't just localized. It's a widespread, multi-country crisis demanding immediate attention. According to the latest data released by the Centers for Disease Control and Prevention, CDC, on July 1, 2025, the U.S. has experienced a significant increase in measles infections. The agency reported 40 additional cases today, pushing the total for the year to 1,267, just 8 cases shy of surpassing the record high set in 2019, the last time measles was eliminated nationwide. This alarming trend is fueled by a combination of smaller, travel-related outbreaks and a substantial number of cases linked to larger outbreaks, most notably in West Texas. Currently, 27 outbreaks have been identified across the country, with 88% of confirmed cases traced back to these clusters. For context, the United States saw only 16 measles outbreaks throughout the entire year of 2024. This situation is compounded by escalating cases in neighboring Canada and Mexico. The Pan American Health Organization, PAHO, reports a staggering 29-fold increase in measles cases across the Americas compared to the same period in 2024. Canada has confirmed a total of 3,170 cases, including 1 fatality, marking the highest number since the disease was eradicated in 1998. Mexico has recorded 2,597 cases, with 9 deaths, primarily concentrated in the state of Chihuahua. The rise in these countries is largely attributed to the virus spreading within Mennonite communities, highlighting the vulnerability of populations with lower vaccination rates. Health officials emphasize that outbreaks can occur in any area where unvaccinated individuals exist. Adding to the concern, Wyoming has reported its first measles case in 15 years, an unvaccinated child from Natrona County. The source of the infection remains unknown, but public exposure may have occurred during brief visits to a Casper emergency department on June 24 and 25. Alexia Harris, the state health officer, strongly advises that measles is exceptionally contagious and, crucially, preventable through vaccination. The MMR vaccine, measles, mumps, and rubella, boasts an impressive 97% effectiveness in preventing measles, and she recommends that all Wyoming residents ensure their vaccinations are up to date. Beyond Wyoming, several other states are grappling with new cases. Utah has reported 2 additional infections, bringing its total to 9. Michigan has confirmed a second case in Kent County, with the individual having recently traveled internationally. Florida has also reported its 3rd case this year, involving a young adult exposed during travel abroad. Finally, Kansas has documented 3 more cases, all linked to the ongoing outbreak in the southwest of the state, which is connected to the larger West Texas cluster, impacting 11 counties. What do you think? Do you believe current vaccination rates are sufficient to protect the population, or are more targeted efforts needed to address vaccine hesitancy? Share your thoughts and perspectives in the comments below. Let's discuss how we can collectively combat this resurgence of measles. For measles outbreak in Kentucky, 11 cases confirmed in 2025. Breaking update. Kentucky's measles cases surged to 11. Here's what you need to know. Imagine this. A highly contagious disease spreads rapidly across communities, despite existing vaccines. That's exactly what's happening with measles in Kentucky, where health officials just confirmed 4 new cases in Fayette County. This brings the state's total to 11 cases this year, and the situation is more complex than you might think. Here's the breakdown. 1. Local outbreak links to earlier case. The heart of this story lies in Fayette County, where these 4 new cases are directly connected to an earlier measles outbreak that began in Woodford and Fayette counties. Public health officials stress that all affected individuals have been under quarantine since the initial case was identified, minimizing risk to the general population. However, this cluster isn't isolated. An unrelated measles case has also emerged in Todd County. 2. National trends versus local reality. While Kentucky battles these cluster outbreaks, measles cases are skyrocketing nationally. The CDC reports over 1,200 confirmed cases so far in 2025. Why does this matter? Measles remains one of the most infectious diseases known to humans, with the potential to cause severe complications like pneumonia and brain inflammation. 3. The vaccination debate heats up. Here's where opinions often clash. Should school districts enforce strict vaccine mandates to protect immunocompromised children, or do these policies infringe on parental rights? Public health experts overwhelmingly recommend the MMR vaccine, but vaccine hesitancy persists in some communities. This brings up an important discussion. How can we balance individual freedoms with collective responsibility for public health? The recent case surge in Kentucky and beyond proves that vaccination remains our most powerful defense, but only when communities embrace it. Action steps for residents. Check your vaccination records, especially if you're unvaccinated or received doses before 1963. Consider boosters if you're traveling internationally or in high-risk environments. Report any symptoms resembling measles to healthcare providers immediately. But here's a question that sparks debate. Should emergency measles quarantines prioritize public safety over personal autonomy? We want to hear from you. Share your thoughts on this delicate balance in the comments below. Copyright 2025 Scripps Media Inc. All rights reserved. Chain your weekly dose of bluegrass positivity. Subscribe to our free newsletter celebrating Kentucky's brightest stars and hidden gems delivered straight to your inbox. 5. Measles outbreak 2025. Record high cases in the U.S. The United States is facing a significant public health crisis as measles cases have surged to an alarming record high, the highest since the disease was declared eliminated in the country. This troubling trend is largely attributed to declining vaccination rates among children and a persistent outbreak that originated in an area of West Texas where vaccination coverage is notably low. In 2025 alone, there have been at least 1,277 confirmed cases of measles reported across the nation, according to data from the Johns Hopkins University Center for Outbreak Response Innovation. Remarkably, this figure has already surpassed a previous record set in 2019, which saw a total of 1,274 cases, and we are only halfway through the year. Experts caution that the actual number of cases this year may be significantly underreported, as many instances go unrecorded. Tragically, 3 individuals have succumbed to measles this year, 2 children in Texas and 1 adult in New Mexico, all of whom were unvaccinated. This number matches the total fatalities from measles in the United States over the past 25 years. Measles was officially declared eliminated in the U.S. in 2000, meaning there had been no continuous transmission for over a year. Achieving this status was hailed as a monumental public health success, primarily due to advancements in vaccine development. The measles, mumps, rubella, MMR vaccine, which is the most widely used, became available in the U.S. during the 1970s. Historically, prior to this year, the average number of measles cases reported annually since the elimination was around 180, according to CDC data. However, in 2019, significant outbreaks in New York threatened this elimination status, particularly within Orthodox Jewish communities in Brooklyn and Rockland County, which had been targeted by anti-vaccine misinformation for years. This year, Texas has reported the majority of measles cases, with over 750 confirmed cases linked to a single outbreak that began in late January. If the number of cases from this outbreak continues to rise into January of the following year, the U.S. risks losing its measles elimination status. Most of these cases, over 400 since the beginning of the year, are concentrated in Gaines County, where vaccination rates are alarmingly low. In the 2024-25 school year, nearly 1 in 4 kindergartners in Gaines County lacked the required MMR vaccine, making it one of the worst vaccination rates in the state. Additionally, dozens of cases in New Mexico and Oklahoma have been traced back to the West Texas outbreak, and there are also potential connections to cases reported in Kansas. In response to the outbreak, special vaccination clinics have been established, providing additional coverage for thousands of individuals. Many affected counties have also revised their vaccination guidelines, allowing infants to receive their first shot as early as 6 months instead of waiting until they are 1 year old. In New Mexico, the number of MMR vaccines administered this year has nearly doubled compared to the same time last year. A recent analysis of health records by Truveta, a healthcare data and analytics firm, indicates that early vaccination rates among infants in Texas have significantly increased. This year, MMR vaccination rates for 6-month-olds in Texas are over 8 times higher than in 2019, and during March and April, about 1 in 5 children who received their first measles shot did so before their first birthday. However, while the rate of new cases from the West Texas outbreak has slowed, cases continue to rise nationwide. There have been at least 27 outbreaks defined as 3 or more related cases, with at least 38 states reporting at least 1 case this year. In Colorado, cases surged last month when an infectious traveler flew into the state, resulting in multiple cases among passengers on the same flight and others in the airport, leading to broader community spread. Other cases in Colorado were linked to travel to Chihuahua, Mexico, where a significant outbreak is affecting the local Mennonite population. Furthermore, Ontario, Canada, is experiencing a large outbreak connected to multiple cases in Michigan. Tragically, at least 1 person has died from measles in Canada this year, alongside 9 deaths reported in Mexico. In April, Mexico issued a travel warning for individuals heading to the U.S. and Canada due to the high rates of measles cases. The CDC has also intensified its travel guidance, recommending that anyone traveling internationally be vaccinated with 2 doses of the MMR vaccine. The overwhelming majority of measles cases in the U.S. this year have occurred in unvaccinated individuals. Only about 8% of confirmed cases involve people who had received 1 or 2 doses of the MMR vaccine. According to CDC data, at least 155 individuals with measles, approximately 1 in 8 cases, have been hospitalized this year, with 28% of cases occurring in children under 5 years old. The MMR vaccine is both safe and highly effective, with 1 dose providing 93% protection against measles and 2 doses offering 97% protection. However, measles remains one of the most contagious diseases globally. The U.S. Department of Health and Human Services has set a goal for at least 95% of kindergarten children to receive 2 doses of the MMR vaccine, a critical threshold needed to prevent outbreaks of this highly contagious disease. Unfortunately, the U.S. has fallen short of this goal for 4 consecutive years. A record number of kindergartners in the U.S. received exemptions from required vaccinations during the 2023-24 school year, leaving over 125,000 new school children without coverage for at least one state-mandated vaccine. When the measles case count reached its previous record in 2019, both the HHS Secretary and CDC Director at the time emphasized the safety and effectiveness of the MMR vaccine, urging Americans to get vaccinated. However, the CDC currently lacks a director, and HHS Secretary Robert F. Kennedy Jr. has a complex and controversial history with measles vaccines. In April, when the U.S. had around 600 measles cases, Kennedy made a strong endorsement of vaccination, which starkly contrasted with his previous opposition to measles vaccines. Last month, he also dismissed an expert panel of vaccine advisors that has historically guided federal vaccine recommendations, a move that raised concerns among public health officials nationwide. Dr. Bruce A. Scott, president of the American Medical Association, expressed concern stating, "With an ongoing measles outbreak and routine child vaccination rates declining, this move will further fuel the spread of vaccine-preventable illnesses.